Mayo Clinic Arizona has announced a 1.2 million square foot expansion to their Phoenix campus, an investment of nearly $1.9 billion. Joining us now is Mitchell R. Humphreys. Dr. Humphreys, he's director of the expansion project, and good to have you here. Welcome to Arizona Horizon.
Thanks so much for having me.
$1.9 billion investment in Arizona. Why the decision to expand?
So this is so important because when you think about healthcare in Arizona, you think that there is healthcare in Arizona. But what Mayo's recognized is how important it is for serious and complex care. And so that is where this investment, investing in our future, really transforming how we think about healthcare and how we deliver healthcare.
Is this what you mean by innovative care concepts and integrated technologies, these sorts of things?
Exactly. So really blurring what we think about in physical spaces and digital spaces. How do we have digital enhance what the patient goes through? How does it help our staff? Things like ambient listening, where your space is listening, taking notes so the doctor's no longer looking at a computer. Records automatically pulled up just to facilitate the patient's journey through the healthcare system.
So digital care is a big factor here.
It's a big factor. It's really blurring the lines between physical and digital space, not just relying on one thing, challenging the conventional thoughts that we've had about healthcare, really transforming the way we think and we deliver healthcare.
Blurring the lines between maybe inpatient and outpatient care?
That's exactly right. So what used to be only an outpatient room, how about if that patient is seen there and then their care escalates, and instead of them moving around, that space changes to meet the needs of the patient, really focusing on that patient journey.
Obviously better for patients, better for staff. How so?
So part of this project is focusing on the patient. So whenever you focus on the patient, you always get things right. But for us to deliver the best care, you have to think about the staff. How do they get there? How do you facilitate the job? What can we do in terms of automation, robotics, ambulatory care centers, all of these kind of things to help us care better for patients today?
How do you know which direction to go, that this is what we should do over here and this is what we should do over there? Are there studies? I mean, do you take input from staff? How does it work?
So it's a huge project and a huge undertaking. So we have data, we have demand data. We know how much we need in terms of imaging, how much we need in terms of ORs, how much we need for scheduled provider rooms. We take all of that together, we lean into the expertise of our scientists and our surgeons and our staff. We facilitate all that to really think about what do these spaces look like. And the way that we're thinking about these spaces in something called a neighborhood concept, where it doesn't just mean adjacency, but it's really thinking about access, who needs what, and how we deliver that care.
Interesting. Okay, so 1.2 million square feet, and we're looking at some, just, you know, this is just incredible looking stuff here. That's what, like, increases 60% the size. That's already, anyone who's been out there, this is already a mammoth endeavor.
So yes, right now we're at about 3 million square feet of clinical space, so we'll add 1.2, so it's a 60% increase in our space. 30% increase in our OR capacity, and almost a 70% increase in our imaging and our cardiology and other aspects of care.
Are you building out or building up or both?
Both. So we're building up and we're building out. And so we're thinking about that patient journey. How do we create these spaces where patients can get where they need to be without a lot of intentional effort, unintentional wayfinding, so they know where to go and how to navigate through our system?
More traditional things, beds, operating rooms. How many more? Or about a clear number, but lots more, significantly more, or again, is it more technologically based?
Significantly more of both. So more of our clinical space, or what we would call our dedicated rooms for patient scheduled encounters, but also thinking about the support services that go into that, the imaging, the MRIs, the CTs, the ORs, also thinking about new cures, new innovations, theranostics that bring in some of those other aspects like digital
I want to go
care.
back. You mentioned neighborhoods, the idea of care neighborhoods. Talk to us more about that idea, how it was developed and where you see it out in Phoenix.
Yeah. So when we think about care neighborhoods, this is a concept that comes from our leadership. And what it is really taking that idea of what it takes to deliver category of 1 care to that patient, not thinking through a disease process, but maybe putting research, education, different services together so they're talking and they're focused on that patient. It's a new model of care that we haven't done before. We've traditionally been thinking, here's my department, here's my land, here's my department, here's this land. Let's shake that up and think about what is the needs of the patient and what's the journey of the patient need. So say they need labs in their neighborhood that's familiar to them, they can get their labs, they can get their care, everything at one place that's adjacent, but also maybe they go out of their neighborhood for access to other cares, to really transform their experience to focus on the patient.
Preventative medicine, how much is that going to be increased with this expansion?
We're hoping that preventative medicine is part of this, and we're leaning into that digital technology to help us take care of more patients in more ways, in different ways.
How long has this expansion been in the works? This isn't something that just someone came up with, I'm sure.
No, we've been working on this particular proposal for about 18 months that went to the Board of Trustees, and we just recently got approval that we announced in March.
And the timetable is?
Hope to finish first patient seen in 2031 for project completion.
Wow, so design probably right now, still in the design, but the shovel starts relatively soon?
So we'll start with the site make ready later this year, and we have some shell space on campus that we'll be finishing along with the neighborhood concept.
You know, 2031 sounds like a long way off, but it really isn't, is it?
It's not as long as we think.
No, not. Dr. Mitchell Humphreys, again, Mayo Clinic, and this is called Bold, Forward, and Unbound. Good luck and congratulations.
Thank you so much.
Good to have you here.
Thank you.